Yes, and in fact, many health services across the world are dealing with the same thing. So we've not only got the ongoing requirement for surgeries or medical investigations and appointments within outpatients in the hospital, but we have this backlog. People have been very patient with us and have held off requesting their appointments and have kept away, which has really helped us. But so we're dealing with two strands of this. So surgeries. You talk about surgeries. We are almost back to normal in terms of the pace of the surgeries. But of course, again, we have to be mindful of COVID, which means that we have to space some of the surgeries out so that patients are not waiting in the waiting room together. For a relatively minor surgery, for example, if you were going to have an arthroscopy on your knee, for example, that's a relatively minor surgery. We will swab somebody 48 hours before that surgery, and we will ask them to stay in self-isolation until their surgery, on the basis of the fact that between the swab and the surgery, we don't want them to pick up the virus. But the difference is, if, for example, they did become unwell in those 48 hours, or we found a positive result from the swab 48 hours before, because it's relatively minor surgery, we can essentially turn that off and we can put somebody else in their place. There's no massive impact on the resources. Day surgery, that is often the case for that. But for a big surgery, for example, a joint surgery, or major abdominal surgery or something like that, we will ask somebody to self-isolate for 14 days beforehand, which is enormous and a massive impact on somebody. But the research is the evidence is very clear that if you catch a COVID infection in your post-operative recovery period, your outcomes can be very poor. Because your immune system's reduced by your body's under strain, your immune system's reduced having had a general anaesthetic, and you're trying to recover from a surgery. So we have to protect you, and we ask for those 14 days to make sure that you don't have a positive swab, not only to protect you, but also because some of these surgeries are very difficult to turn off. We've got the surgeon's time, we've ordered specific equipment or specific joint implant, for example, and to then suddenly stop that surgery is very difficult and increases the waiting time for other people.